All right, once again, getting ready to spend some time with the good doctors at the Allegheny Health Network. And if you ever need a great doctor, I suggest you call 412 Doctors. Tonight it's cardiology and chest pain. Dr. Balacco, Dr. Gabriel, and Dr. Pfeiffer. When you think chest pain, gentlemen, that really could be a whole lot of things as far as why you're having it, but it's something that you should never, ever just kind of let happen and forget about, because there's a reason, and that's why we're bringing you this show tonight, right?
That's
Doctor?
right, Dr. Blanco. It's very important if you have chest pain to make a diagnosis as to why you're having chest pain, and the earlier the diagnosis, the sooner treatment can be good.
As we've said before, time is heart, and we don't want to lose any heart tissue, and time is matter when you have a blocked artery. But there are other situations where chest pain can be critical, not always a myocardial infarction or heart attack. George?
Yeah, we want to make sure it's not a aortic problem. It could be a stomach problem, an ulcer. It could be something as benign as just some reflux as well. So we want to make sure heartburn will do it.
Yeah.
So we want to make sure we're doing what we're dealing with and how to treat it correctly, so we lessen the risk of problems.
You know, one of the things that we talk about on the program a lot, Doc, and Dr. Gabriel, Dr. Balacco, is the fact that, you know, if someone is having a heart attack, what you do, and, you know, the symptoms as far as nausea and back aches and the pain shooting down your left arm, all of that. But if someone actually has a heart attack in front of you and there's no medical help nearby, what do you do?
911. Never let a relative drive you to the hospital or that nature, because something can happen along the way that they won't be able to help you, especially if you need to be obviously cardioverted or defibrillated. George, would you agree?
Oh, absolutely. I think the first thing is to get help on the way and get the patient to a medical facility where we could deal with it. Like you said, you want to make sure it's a heart attack. I guess if you meant they had a cardiac arrest in front of you, obviously you want to start CPR and airway and that kind of stuff. But if they're having severe chest pain or sweating or diaphoretic, and you think it's a heart attack, well then you want to call 911 and you want to get them to the hospital.
And they can hook you up to an EKG in the ambulance, taking you to the hospital, and that can be communicated to the emergency department. They can alert the people at the hospital so that if it indeed is a heart attack, they can get you to the cath lab, or if that's necessary, right away. And as we said, that first 90 minutes is very important.
Oh yeah, we'll be waiting for you, and at least it's the hospitals that are able to do interventions. We could almost bypass the emergency room, get them right to the cath lab where we could take care of business.
You know, the great McGovern group, I have such admiration for, and been on the program with us many times, Dr. George McGovern. They are really everywhere in this region, obviously a part of the Allegheny Health Network. One of the things that I've noticed, and you guys can correct me if I'm wrong, because I've spent a lot of time visiting my friends in the hospital, and I'm a baby boomer, mid-50s, early 60s, there seems to be a lot more coronary bypass surgery happening in people my age, or is it just that I've gotten older and this is about the age that it usually happens? But thank goodness for the McGovern group, because very little time down in the hospital, they're back up and back at it within a few short weeks. So talk to me about why it seems that a lot of baby boomers are undergoing that procedure now.
Well, I don't mean to have Dr. McGovern upset with us. I think as cardiologists, we're hopefully trying to avoid a lot of these bypasses. We have newer stents that tend not to block up as much as they used to. I think that we have a lot of different procedures that doesn't require open heart surgery. So us as cardiologists are really trying to keep you out of the operating room if we can. Now there are patients that need the surgery, and like you said, it's probably just that time of their life where coronary disease is manifested to come out and cause problems.
It's a very commonplace thing. Maybe it's because we're all in the same shoes and we're just starting to see it. I mean,
Right.
more and more of the patients I see have my birth dates. And I think I'm just aware of that. But George is right. Nowadays, with more and more advancements in stents, we see that we're able to take patients into the cath lab and quote-unquote avoid the surgery. And there's more and more invasive procedures that are done through catheterization, such as aortic valve replacements without opening a chest. Mitral valve clips and repairs, which he sees his partners do at Allegheny General. So the idea of everybody going open heart surgery is kind of becoming a changing pattern. More and more we're able to take them to cath lab and avoid that.
All right.
Or at least prolong it
Go
to
ahead,
another
Jerry.
time.
I think another important thing, as we are getting older, and our population is getting older, we're living longer,
Right.
so you have a greater chance to get any disease, including heart disease, cancer, what have you. But another thing that has had a major impact, I'm not an internist, but one thing that's had an impact are the statins. I think that people who get started on statins keep their cholesterol, triglycerides under control,
Right.
they have a better chance of living longer without heart disease.
And one of the other things that you've always preached for the decades you've been doing this show, and I listen most of the time, and that is preventative by not smoking, trying to eat a proper diet, get some daily exercise, but more importantly, regular trips to your physician. And that's what's so great about the Allegheny Health Network. They've got that umbrella of physicians, so you can plug into whatever type of physician you need, and that way, chronologically, you hopefully live a lot longer, but you maintain good health because you're on top of it.
But we're just part of that change now. We're just seeing it now. We're more healthier foods, whether you go to McDonald's or wherever anymore. We were like late in that stage. It's the generation behind us.
Don't get on McDonald's. You gotta have a little Big Mac every once in a while. One Big Mac's not gonna hurt. It's moderation.
I agree. We're right on the changing cusp of where people are thinking a lot more healthier. I mean, you know, exercise has become in vogue again. Eating right, watching what you eat. You know, all, like he said, all the fast food restaurants are having, you know, healthier menus. So, and now with statins and intensive therapy to prevent these events, I think we're getting better.
And we have the Allegheny Health Network, and when my good friend Dr. Pfeiffer underwent a procedure a couple years ago, I was down there, and I have been many times, the cardiology floor at Allegheny General. It is absolutely, here we go with the, well, state of the art, need I say more? It's one of the most incredible things I've ever seen in my life.
And we all should just put that punching bag in our basement. And
I'm trying,
And
Doc.
go after it.
I'm trying.
And not only do you work out your frustrations, but you get some exercise.
Sounds good. Listen, I love talking to these guys, and I want you to call in tonight. It's all about cardiology and chest pains. 866-391-1020, Dollar Bank Instant Access, KDKA.com.